you, Dr. Vasu, for wonderful lecture. You are doing better. We can interact finally, but I think we have already two. So I would like one questions from any audience and otherwise comments from
physicians and surgeons.
Would you like to ask some question? What are you thinking? The day of restart is dying. Because in our we want to treat with economical and we are treating the patient with the free of cost in this. At least for the coming 10 years, 15 years. But the point of our modern forum I am attending, everyone is now switching over there. What is your comment?
It is perhaps, it is the only question, the only outcome question can happen is, then do you really want to shift from mixed drug to novel mix? Now, there is this issue of physiological mimicking the dose of insulin which is normally happening in the body with some exogenous source to match that profile that the way the God has designed would be the best to look for. But if you really talk in terms of your outcome data, in terms of your management of how patients are had been maintained in terms of fasting, BP and A1C, there is not much of a very significant difference. If you can do it well, the last bit that I said, if you could monitor and empower your patient well, then mixed start will perhaps do as good. But the only point is the remaining risk of hypoglycemia because a mixed start stretches till 8 hours. So if you are not had an early lunch by 1, if you had your say breakfast at 8, taken your shot at 7:30, and then you have not had something in between around 10 o'clock, 1 apple or 1 guava or 1 cucumber or that kind of stuff, and you're still waiting like a seminar like this, by 2 o'clock you're knocked, completely knocked out. But with Novomix, that would be less. If the patient is not buying, in case of your concern, where if the patient they get it free.
Yes.
So he will be perhaps, if he attends our lectures, then he will come and coax you for only Novomix.
Demand, no?
Yes. No, demand. That's it.
In last meeting, they are for long term, sir, economically packaging. They are reducing the rate. They are telling that both the rate is hardly for 10% difference. But might be in coming days more and more people will use. They are saying that gradually rate is economically
rate has been more than 25% was the difference. They promised to get it.
Because only thing is that our most of the patients are
absolutely.
And
No.
the data is going in favor of
Mix, no mix, right? Now, point is, if your patient comes, and today in the world of evidence-based medicine management, if they are all very net savvy and they're very well priced patients. So if they come and they demand, as you said, they rightly demand. And now if the economic scale is kind of coming down and if they're matching, there's no question that mix-up should be brought. The packaging should be done. Absolutely.
Comments regarding diabetes challenges we have discussed so much. It is in quintals.
Very relevant observations made by Dr. Basu in his inimitable way. I hope we get the hint, and people of my group who have that prosperity around their middle start getting conscious and take control of their sweetness. I will put it in a very simple fashion, sweetness, and routinely get their postprandial blood sugars done. I have never done an HbA1c because I have been always confident that I am a non-diabetic. But I think it's high time I should also get the screening done, and if required, demand for the brand of insulin that the others are demanding. And I appeal from the medical fraternity and the diabetics in general, come down with the cost so that we can afford it.
Sir, comments. What comments? Regarding diabetes, it is such a disease, that's why we have chosen. I will go for the series of things, not for the eye problem, heart problem, kidney problem, skin problem, diabetes. Everyone is a problem.
Thank you, Dr. Basu.
Doctor,
You must have heard about this.
your branch is a public health problem.
I am not so apprehensive because already we are providing these medicine. Demand always, demand is there, dite hi hobe, and we are prepared for that. But only thing that people should be more conscious what to do. Only by taking this therapy they are not going to be cured. Certain steps as been described that must be followed.
Dr. Mukherjee, your diabetes and screening were one that will be outcome or one register.